Good morning. I want to thank you all for being here. Javier Becerra, Attorney General for the state of California. I'm joined today by two individuals who probably have far deeper knowledge and understanding of the issues that we're going to discuss today than I, because they have been in the trenches for some time, making it possible for Americans to believe that the healthcare system is here to help them and their families stay well. I'd like to introduce Carmela Coyle, who is the president and CEO of the California Hospital Association, and also Gail Batiste, who is a registered nurse and also the president of SEIU 121. And both of them will speak right after I do. I'll ask Carmela to say some words first. She will turn it over to Gail, and then we'll take some questions right after that. It used to be, how often do we start a sentence like that? It used to be that the leading cause of personal bankruptcy in the country was the fact that you went to a doctor or a hospital and you couldn't afford to pay your medical bills. So you were left with decisions. Do I take my child to the hospital, knowing that I might not then be able to pay my mortgage or my rent moving forward? It used to be that we allowed insurance companies to deny you coverage based on a pre-existing condition, such that if you were a woman, because you could get pregnant, you were considered a pre-existing condition. And it used to be that an insurance company could charge you more for the same type of health insurance coverage as a man, simply because as a woman you were considered a pre-existing condition. It used to be that you could be denied services without paying for them under Medicare for things like wellness care, cancer screenings, mammograms, immunizations, the type of care that today a senior under Medicare can receive and not have to worry about the cost, because they are all part of the preventative services that under the Affordable Care Act are now provided free. For many years, that was the way of the world. But like so many things in the past, think polyester suits, that's now gone. And that's as a result of the Affordable Care Act. Well, not polyester suits, but the inability to get coverage, to be denied coverage because of a pre-existing condition and so forth. The Affordable Care Act changed the world in America. In fact, it changed the world so much that in California, which took on the task of incorporating the Affordable Care Act in our state, in what we call Cover California, our marketplace, and through the Medicaid expansion program, we were able to add 5 million Californians to the rolls of those who no longer had to worry about going bankrupt because they sent their child to the hospital, that no longer had to worry about denying their child a visit to a hospital because of a pre-existing condition. It was the case that in California, we dropped our uninsurance rates to historic lows to 7% or so, when we hovered in the double digits like so many other states. What seemed unimaginable several years ago is now reality for places like California and others around the country that have taken on the Affordable Care Act. Kids can now stay on their family's health insurance plan until they turn 26. Preventative services like cancer screenings, birth control are all covered out of pocket with no particular expense to the families involved anymore. You can't be asked to pay more or be denied care any longer simply because you're a woman. And if you're one of the 133 million Americans with a pre-existing condition like cancer, you cannot be denied coverage anymore as a result of the Affordable Care Act. That's the good news. Here's the bad news. In February, the state of Texas and some others filed a lawsuit that attempts to end the entire Affordable Care Act. It is an irresponsible action. It is a legally unsound action, and it is a dangerous action for millions of Americans who left the bad days of pre-existing conditions and inability to get care for their children. This lawsuit wants to stop Medicaid from expanding. It wants to stop the tax credits that help people afford their health insurance. This lawsuit wants to allow insurance companies to deny coverage to people with pre-existing conditions. This lawsuit wants the court to take away seniors' prescription drug discounts and many more things. That's why today we're announcing that, along with 15 other attorneys general throughout the country, we are filing a motion to intervene in this case in order to defend not just the state of California, but the people of America and their families across the country when it comes to having quality, affordable health care under the Affordable Care Act. We're taking this action to protect the health and financial security of millions of people in our country, as well as the billions of dollars of federal funds that go to our states to make sure that we can afford the health care that our families need. In our motion to intervene, we argue that striking down the Affordable Care Act would cause immediate and irreparable harm to the people of our states. Over 11.8 million low-income individuals receive coverage through Medicaid as a result of the Affordable Care Act in the states that have expanded access. This number includes some 3.7 million modest-income Californians as well. There are some 10.3 million people around the country who've obtained health insurance through the Affordable Care Act's marketplaces, what we call Covered California here in our state. 84% receive federal tax credits in order to help them pay for the insurance that they now have. The consequences of losing the Affordable Care Act are not hypothetical. Not for a family like Angela's from Yorba Linda here in California. Angela's daughter was born with a heart defect. She has endured to date 2 open heart surgeries before her first birthday. Needless to say, that could have bankrupted Angela and her family. But thanks to the Affordable Care Act, Angela's daughter can grow up without fear that her pre-existing condition will deny her access to the life-saving treatment that she has received. Angela's husband is an Air Force veteran and a small business owner, and they receive coverage through the small group plan under the Affordable Care Act. If the ACA is repealed and the price of insurance goes up, Angela doesn't know how she will continue to cover the health care costs of her family and certainly not of her daughter. That's what's at stake in this lawsuit filed by Texas. That's what's at stake for the well-being of so many millions of California and American families. If this case goes forward, it will cause chaos in the marketplace, real consequences for families, providers, insurers, businesses, and states. Now, we've seen this time and time again. Republicans are trying to use the court to take down the Affordable Care Act because there's 70-plus attempts to do the same thing through Congress have failed. This action, filed by Texas, is the latest that my healthcare task force here in the California Department of Justice has decided to take on because it's our intent to protect the health of California families. We stand ready to respond to all threats to the Affordable Care Act. We are intervening and hope the court will allow us to come into this case for the specific purpose of defending families who have received coverage for health care under the Affordable Care Act. Because we refuse to go back to the days when health care for our families was left to those who were healthy or wealthy. We refuse to go back to the days of polyester suits. And so here we are, ready to join in this lawsuit to defend the Affordable Care Act if the administration is unwilling to do so. It's too important for California. It's too important for our economy. And certainly it's too important for families like Angela's, whose life, for at least for her daughter, may be at stake. With that, let me now ask Carmela Coyle, the President and CEO of the California Hospital Association, to provide us with some words.
Thank you. Thank you very much. I am Carmela Coyle, and I am the President and CEO of the California Hospital Association. And on behalf of California's 400 hospitals, I am pleased to be here today in support of Attorney General Becerra's effort to protect healthcare coverage for Californians and to stop the dismantling of the Affordable Care Act. California is enormous, right? We have a population of 40 million people. California's hospitals have the privilege of caring for those 40 million people. We are powerful. We are the 6th largest economy in the world. And the state of California is both privileged and at the same time poor. We have some of the wealthiest areas in the United States. And if you adjust for the cost of living, we also have the highest poverty rate in the country. The Affordable Care Act allowed us to make tremendous advances in health coverage and in health care. California ought to be celebrating what the Affordable Care Act has done for us. We now have 93% of Californians covered as a result of the Affordable Care Act. And it not only gave us coverage, it gave people a way to access the care that they really needed. That was done through the Affordable Care Act and through an expansion of our Medicaid program, otherwise known as Medi-Cal. And its preservation is critical. We now have 1 in 3 Californians who gets their health care through the Medi-Cal program. It has allowed doctors and nurses and hospitals to make tremendous strides in getting people the right care at the right time and in the right setting. And what do I mean by that? Before the Affordable Care Act, for many people, their only option to receive care was in a hospital emergency department. Very often the most expensive setting that's available, and very often people would wait until their care was so acute and so needed. What we now can do, given that people have coverage, is we can make certain they're seeing a primary care physician and getting all of the additional care that they need in addition to those emergency room visits. There is nothing more important for the health of Californians than preserving the Affordable Care Act. We can't let the politics in a handful of states risk and erode the gains that we have made here in this state and the Affordable Care Act expansion, which we have used so well to provide coverage for so many. So thank you, Attorney General Becerra, for your state and for your national leadership by interceding to preserve coverage for Californians. And with that, I would like to introduce our next speaker, please. She is Gail Batiste. She is a registered nurse, and she is also president of SEIU 121. Gail?
My name is Gail Batiste. I'm a registered nurse, and I'm also president of SEIU Local 121 RN. We represent registered nurses and professionals throughout Southern California. I'm also an operating room nurse at Dignity Northridge Hospital. And at that hospital, prior to the ACA, I have seen the difference of what happened to my patients prior to the ACA. They waited to come into the ER because they could not afford the care, and when they came to the ER, they were critical. They were either admitted into the ICU or they were admitted into the operating room from the ER because they were so sick. I became a nurse 34 years ago because I wanted to care for the sick and the vulnerable. And that's why I'm here today, standing with the Attorney General Becerra. I'm here to stand up for my patients. The Texas lawsuit is just another shameful attempt by the Republicans and Trump administration to dismantle the Affordable Care Act. Another attack on the most vulnerable, Americans. If their lawsuit is successful, it could potentially invalidate crucial parts of the ACA, such as eliminating health care coverage and funding for all Americans, including seniors, children, people with pre-existing conditions and disabilities. When I became a nurse, I took an oath to protect my patients and to advocate for them and do no harm. What Texas and Washington politicians are doing is endangering my patients by going after their health care. This isn't sound policy, it's just plain reckless. We cannot go back to the pre-ACA days when insurance companies denied patients with pre-existing conditions. We cannot go back to days when families were bankrupt because of the high cost of medical care. We cannot go back to the days of patients using the ER for primary care visits. We cannot go back to the most vulnerable of ours being uninsurable. My patients and I thank Attorney General Javier Becerra for filing this motion to intervene. Thank you so much.
Gail, Carmela, thank you very much. We'll go ahead and take any questions you might have at this stage. Sure, very quickly in Spanish. Hoy estamos anunciando que 16 estados, fiscales de 16 estados, estamos tomando acción para entrar a un caso para defender the Affordable Care Act, la ley de cuidado médico que ha brindado acceso a los hospitales, a los doctores, a millones de familias, especialmente aquí en California. Y queremos proteger esos avances que han permitido que las familias por toda la nación tengan acceso a un cuidado médico por cual pueden pagar. Hay un caso empezado en Texas que trata de quitarle ese seguro médico a muchas familias, millones de familias, y estamos pidiéndole a la Corte que nos dé la oportunidad de entrar en ese caso para defender el programa Obamacare que le ha brindado a millones de familias acceso por fin a un cuidado de calidad para sus hijos y su familia. And I want to thank both Carmela and Gail for their words as well, to show that this is a crucial issue for so many families here throughout California and the United States. Thank you.